We've all been reading about the crisis that there is because of drug shortages. And the question is there really a drug shortage, or is this some kind of ploy that's going on by the FDA, by Big Pharma? Is there some collusion between them that's leading to shortages that really don't exist? I'm not making that accusation, but I wonder about the reliability of these organizations. They have done so many things where they're in collusion together, and where Big Pharma has done things that have cost tens of thousands of people their lives. When there's not enough of a drug to go around, everybody appreciates it more. It's a great way to get information about your drug out there. And what would happen if one drug was short? Wouldn't that bring another one that was available into focus? Could it be that what's happening is they're highlighting other drugs that maybe they have an abundance on, that they're losing money on because they're not selling enough, and now bringing those into a place where they're being sold? I don't put it past them, not an accusation, but I wonder about that. When you think about Big Pharma, really, if they had a massive multi-billion-dollar drug out there, which they do when it comes especially to chemotherapy drugs, you'd have to think they'd do everything in their power to make sure that that drug was brought back into production so that it could be sold and they could make a profit. So if there's a real shortage, it would be something that would be understandable if there's a problem with mechanical issues in production, or there are supply problems because they can't get the ingredients they need to make a drug, or there's contamination or infection, or if there's some kind of quality issues. That would be understandable. But the problem I see is that it's hard to know when they're telling us the truth, when they're just using us, when they're trying to manipulate the market so they can sell one drug over another, and how they can also promote that drug in a direct-to-consumer ad. So who knows what the story really is, but I'm suspicious, and I'd like to see some of the inside data. That would make me a lot more comfortable to believe that indeed there's a drug shortage.